Hi friends, today's video is about cutaneous nerves of the back of the leg. So the skin of the calf can be divided into three vertical areas. So suppose this is the calf, I am dividing it into three vertical areas, the medial, central and lateral. Roughly, there are two nerves for each area with an additional nerve for the heel. So the medial area is supplied by the posterior branch of the medial cutaneous nerve of thigh and the saphenous nerve. Central area is supplied by the posterior cutaneous nerve of thigh and the sural nerve. Lateral area is supplied by the lateral cutaneous nerve of the calf and the sural or the peroneal communicating nerve. The heel is supplied by the medial calcanean branches from the tibial nerve. So in this diagram we can clearly see these nerves. So the medial area supplied by the posterior branch of the medial cutaneous nerve of the thigh and the saphenous nerve. Central area by the posterior cutaneous nerve of thigh and the sural nerve. Lateral area by the lateral cutaneous nerve of calf and the peroneal or the sural communicating nerve. So going into some sort of details, we can first see the saphenous nerve. So the femoral nerve we have already discussed in detail. So if you remember, the saphenous nerve is a branch from the posterior division of the femoral nerve. Its root value is L3 and L4. It arises in the femoral triangle. It pierces the deep fascia on the medial side of the knee between the sartorius and the gracilis. Then it descends very close to the great saphenous vein and it supplies the skin of the most of the medial area of the leg and the medial border of the foot up to the ball of big toe. Next, we can see the posterior branch of the medial cutaneous nerve of thigh. So, it is one of the two cutaneous branches from the anterior division of the femoral nerve. One was the medial cutaneous nerve of the thigh and the other was the intermediate cutaneous nerve of the thigh. So, here the root value is L2 and L3. It supplies the skin of the uppermost part of the medial area of the calf. Next, we have the posterior cutaneous nerve of thigh. It is a branch from the sacral plexus. So its root value is S1, S2, S3. It descends along with the small saphenous vein. So here we can see the posterior cutaneous nerve of thigh descends along with the small saphenous vein. And it supplies the skin of the upper half of the central area of the calf. The skin of the upper half of the central area of the calf. Next we can see the sural nerve. The sural nerve is a branch of the tibial nerve. So its root value is L5, S1, S2. It arises in the popliteal fossa, then it descends between the two heads of the gastrocnemius. It accompanies the small saphenous vein. It is joined by the peroneal communicating nerve about 5 cm above the heel. So the sural nerve accompanies the small saphenous vein and about 5 cm above the heel it is joined by the peroneal or the sural communicating nerve. After passing behind the lateral malleolus, it runs forwards along the lateral border of the foot and ends at the lateral side of the little toe. So it supplies the skin as shown in this figure. Next we have the lateral cutaneous nerve of the calf. It is a branch of the common peroneal nerve. So its root value is L4, L5 and S1. It arises in the popliteal fossa and it supplies the skin of the upper 2/3 of the lateral area of the leg, both in front as well as in behind. Okay, then the peroneal communicating nerve. It is another branch of the common peroneal nerve. Its root value is L5, S1 and S2. It descends and joined the sural nerve about 5 cm above the heel. Okay, so before joining with the sural nerve, it supplies the skin of the lateral area of the calf. Finally, we have the medial calcanean branches. They are the branches of the tibial nerve. They perforate the flexor retinaculum and supply the skin of the heel and the medial side of the sole of the foot. So that is about the cutaneous supply of the calf. Hope you understood and thanks for watching.